This video is about my ChatGPT prompts that I use. It's one of the most useful tools in my studying, be able to get questions answered and get information faster, not have to Google things and go down a rabbit hole for every little thing. So, I guess there's some disclaimers I can make or things I could clarify, but I'm going to start out by just going into it and then maybe address those things that I think of them. So, my first big chat that I started using, my prompt was the etymology prompt, which I have here as Eddie. This one, you could say it was the most important one. Maybe not now in second year, but for the foundation that helped me build in first year, it was my most important one. Very simple. Give the etymology, label it bold, and I'm going to put these in my description for the video so it can be copied and pasted. But I just say, give me the etymology and the purpose of each term that I type in. That's the whole point of it. So I guess I can use this for examples. This was huge in anatomy. Well, no, it's huge for every class. But anatomy was one really big one, but really to every class because, with medicine, there's a lot of jargon and everything. And it's just a lot easier to learn the terminology and everything when you know what the different parts of the word mean. So with the techniques that I use, so a lot of them, what makes them more possible or more feasible is being able to have these kind of chats where it's quick and easy to get the information you need. So which technique would this be? It would be hyphen, where I break the word up into different parts and put hyphens between them to force myself to pay attention to the components that make up the word and what they really mean. I have the game that I play too with equals and versus, those two moves. Which move would this fall under? It would fall under equals. So pyuria equals pyuria, right? The hyphenation equals puss urine. So it's a person with puss in their urine, stuff like that. And iridia, and is no, iris is iris. So I just put the things in, and even with anatomy, I used to take the course pack, make a list of all the bolded terms in that chapter for that week at the start of the week, and then put each term into this chat, because then I have the most fundamental beginner piece of information to associate to that word, which is what the term actually means, why it's called that, and what the purpose of that thing is, what its function is or what it does. It gives me a good baseline, big picture meaning for that term, and so I have somewhere to start, and then I can continue to build off of that. So that's what I would do for anatomy. I would put each bolded term into here, and then put a check mark beside it on the list. And then I put each bolded term into Complete Anatomy 3D, so I could see what it actually looks like, and then I put a second check mark. So each term I wanted to have two checks, one for the verbal aspect and one for the visual aspect. So yeah, but you just learn these terms like algia is pain, erythro is red, and this for me was really, really helpful just to be able to every time I saw a new term, because you learn so much new vocabulary in med school. Every time I learn new vocab, I put it in here. And this is not everything because I have to remake the chat and delete it every once in a while because it gets slower the longer you keep it for. So I just copy and paste that same prompt, put it in a new chat, and then make that my new etymology chat. You see me. Anyways, yeah, cryptogenic. Gen is Genesis, as in the first book of the Bible, as in creation or origin or birth. So cryptogenesis or cryptogenic would be a hidden cause. Cryptogenic organizing pneumonia, desquamative interstitial pneumonia, the stuff that we're doing now. So yeah, that's really helpful. What's my next most valuable chat? The next most valuable one is actually, am I correct? Which is not the next one in the order, but I guess I'll just do that one. Talk about that one next. So it's basically, I put in statements and then it tells me if I'm right or wrong and why. And it's really helpful because there's times when it's like you think what you need is the answer, but actually a lot of times the difficult part is knowing what question to ask, and it can be hard with the internet, with people, with ChatGPT, with professors, whatever, to ask the question that you need to ask to get the information that you actually needed to complete your understanding. So of course that's an important and good skill to have, but this chat is really helpful because instead of having to come up with a question to ask, a lot of times, what I need is a specific clarification of, is this assertion that I'm trying to like build my knowledge on right or not? So I'll just type it in, and then it'll just tell me whether it's right or not. And it's like, a lot of times it's a lot better than asking a question. It's like you just say what you think and then have it critiqued. And I think even with like, definitely with like even learning with other people, whether it's a study group or professors, a lot of times that's a really great thing, even better than asking a question. It's just saying, I'm just going to explain to you my understanding of the topic, and then you just tell me where I'm wrong. So I guess this chat is like a version of that. So, choristoma, right? You have hamartoma versus choristoma. Hamartoma is tissue in the right location, it's just growing too much, and then choristoma is in the wrong location. I was not sure if choristoma was just because oma means tumor. I was like, okay, it's a tumor, but is it a like cancer tumor, or is it just a like mass or whatever? So I thought, I was pretty sure it wasn't, so I just put it in, and it says correct, it's not. So it's like, instead of having to ask, is a choristoma, blah, 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 I just say what I think. Oh, it just changed it. So these are just some ways that I've used it. Media vessel is muscle, correct. Increased lucency equals obstructive, correct. To see if these associations I'm making about what different clues, diagnostic clues, are supposed to mean to me, if I want to see if they're correct, put them in here, and it will tell me. All thiazides increase sympathetic activity, incorrect. It depends on the which one within the class. Some have that ability to do that, some don't. Like something like this, where I said, oh, Benz-Jones is lambda. No, they can be lambda or kappa. And actually, it's usually kappa. Maybe it's only kappa. I don't know. But, yeah, that's that one. Am I correct? The next one is connect equals. This one is really like more recent. I started trying out this prompt, like putting this in and using this like this year, I think. Maybe this year or late last year. I think it was this year. It was really recent, and I had to like kind of workshop it a little bit and try different things to get it to work and actually give me what I want. But it's really helpful now. So I say I'll type in two terms in this format. Term A equals term B, right? It's an association between things, because that's how I learn things, or like notate a lot of things I'm learning in med school is like this equals this for the association. Like obstruction equals expiratory, right? Versus or obstructive lung disease equals expiratory, versus restrictive equals inhalation, right? Just that sort of thing where you just chunk those things together. So I want it to explain to me how those terms are actually connected. And I give it, don't use too many words, keep it simple and everything. And then I have another version of the chat where this crossed out part, I include it. So I wanted to compare how those two versions, like which one is better. They're both like pretty good. So this is it. I'll just say I started out with the instructions giving it the instructions that I would give it two terms, and it should explain to me how those two terms are associated, basically. But I started using it in a way, and this is not the first time that I use this chat, but that's why it's like I was already doing this, but I started using it in a way where I would just put in one term, and I wouldn't even give it the second term, and it will give me the second term, which was really nice, because one thing that's really important for like what helps me like learn things in med school is knowing what you're supposed to think of when you see a certain term. Like when you see this certain word, what's the first thing you're supposed to think of? What are you supposed to associate it with? Just random example off the top of my head. Nifedipine equals vascular. That's the word that comes to my mind first with nifedipine. Why? Because nifedipine is it's a drug that ends in dippine, which means it's a dihydropyridine calcium channel blocker. That's the class of drug that it is. That's the type. But within that type, you have these different drugs. Nicardipine, clofidipine, nifedipine, etc., etc. The only thing that's the thing that's unique, or the main important thing that's unique about nifedipine compared to those other drugs in that class, is that it's vascular selective. It acts more on the vessels rather than on the heart. So it's like that's the word I want to think of first. That's my association. And that goes with the game as well that I play. If it's two moves, equals and verses that you can use in the game, obviously this chat is the equals move. That's why I called it that, connect equals. And the whole point with that is just those associations, those chunks and categories. Since how I try to approach learning is all about comparing and contrasting, which is equals and verses, this chat is all about the comparison. Comparison might not be the best word, but I just like it because it goes with compare and contrast. It's about connection. That's what it's about. It's about drawing that association between things and explaining what the connection between them is. So it went from explaining the connection to now also making the connection for you. So I'll say umbrella cell equals what? What should I think of? Bladder epithelium. Okay. And it's, of course, it's not like teaching me everything, but I like having that one simple checkpoint that I'm supposed to connect that one thing to. And then I can build from there. Yeah, diltiazem, calcium channel blocker. Digoxin equals cardiac glycoside. Yeah, see, and I can put the same one. Well, I didn't do that here. But I can put the same word with equals more than once, and it will give me a different association each time. So I can, if I'm not satisfied with the first one, I can put it one or two more times and see, okay, now these are three terms or ideas that I should think of whenever I'm dealing with this term. So aqueous, humor, sympathetic. Just the connection between these two things. So I started using that as almost in place of like a definition, rather than getting the definition of what this thing is, because I can get that from the etymology chat where it gives me the, the word roots, the word origin, and the purpose. I'll sometimes, when I see a new term, before I even look up a definition or whatever, I'll just put it in here. So instead of getting a strict definition of this thing is this, composed of this, and kind of meaningless kind of stuff like that, I'm getting what it is that I'm actually supposed to think of when I see that term. Not just what's the literal meaning of it, but what's the significance of it. Why does it matter to me, to someone in med school? So like hemochromatosis, iron overload. It's like a very nice, very quick summary of just what the whole idea of it is. So I use it for all those little jargons too, like RRR, all those little acronyms and things that they use in notes, patient notes, and that stuff that I don't know what it is, and just quickly get it defined. But yeah, so many of them I didn't put two terms. See, this is one where I actually put two terms. Cocaine equals rhabdomyolysis. Why? Sometimes I'll put why in like parentheses to make it like explain a little, like actually explain the connection more, because sometimes the explanation will be these things are connected because this one causes this, but it's like I wanted why it causes it. So sometimes I'll put that in parentheses and that'll help. Yeah, mitral annulus. Like certain things are really helpful. Like let's say, perfect, S3 heart sound, right? It's like that was something where knowing that it's an S3 heart sound is meaningless. The whole point is that it's telling you something and you're supposed to know what it is that it's signifying it, and I didn't know. So it was so nice to just like be able to quickly put it in here, like when I realized I keep seeing this and I don't know what like it is or what it actually means. I just put it in here and it was like early or rapid ventricular filling. I can put it in again and it's like regurge. So it's like, okay, good. That's what the significance of the S3 heart sound is. S4 heart sound equals, and it'll give me atrial kick. In fact, let's see what it gives. A stiff ventricle, exactly. You're hearing the sound of atrial kick because the ventricle that the atrium is emptying blood into, that ventricle is so stiff and overly thick or overly scarred or whatever, right? Either restrictive or hypertensive cardiomyopathy. It's so stiff that it requires extra force to get the blood in there. So you hear an atrial kick. So this is the thing where all I had to put was S4, and now I get the significance of it very quickly. So this chat is very, very, very helpful, and this is one that I use a lot every day, all throughout the day. Volume overload, which I attributed to regurge. So the next one is the opposite of equals and its verses, and this one is also extremely important and extremely helpful. So again, I had the theme of comparing and contrasting, right? Yin and yang. That's equals and verses, and those are the two moves in the game that I play when I'm learning things. Those are the two moves, equals and verses. So of course, I have chats that represent them, and those chats are really important and helpful. So there's verses, and then there's verses short. I've lately been using verses short. It's just two different prompts, the same sort of thing, but slightly different. Basically with the short one, it's not really shorter, but I called it that because it was at the time it was going to be shorter. What it does is, well, first I'll just explain verses. It's really, really nice. It's kind of like equals, where the point was to put two terms and say this versus this and have it explain to me like what makes them, opposite to each other, what makes them contrasted to each other. So it would put the differences, but it would put them the way I started doing them in my notes, where I'll, directly contrast the traits to each other. So, okay. Example, usual interstitial fibrosis versus. So here's the thing. I would put two terms, but then I started, just like with the equals chat, I started putting just one term, and it will fill in the other for me, which is really nice because I think that's one of the most important things to learn or to know when you're learning and organizing information, is not just knowing what this one thing is or what it means, but knowing what this one thing is not. Knowing what this one thing stands in contrast to. Because if you don't know what it's like stands in contrast to, then you don't really know what it means, even if you feel like you can define it and you can explain what it is. So if you tell me, oh, this thing is really big, that's what makes it a big. Oh yeah, I'm just gonna make this up. Large nodule. Yeah, large macro nodule. It's very big. Okay, but it's big relative to what though? Oh, the small nodule, And the small nodule is defined as being, less than this specific number of centimeters, and the large one is greater than that. So I have here the usual interstitial fibrosis versus, and it filled it in for me, non-specific interstitial pneumonia. And it gets these things right. Like, it ends up being the exact relationship you're supposed to know, like, basically almost 100% of the time, which is really nice because, like, medicine and everything, like, at least the stuff we're learning in med school, it's, like, the basics of medicine, so it's, like, the same everywhere. It's very standardized, so it's, like, when it comes to these basic relationships of, like, this versus this, it's all new to me because I'm a student. I'm learning new things every day. But with ChatGPT, it's, like, this is all, like, stuff that's known, so ChatGPT doesn't really mess it up. Like, it makes mistakes and stuff, but with the verses, it doesn't really, is my point. So it's really nice. Just, it's like I don't even have to, like, comb through so much the material anymore to find these relationships. I can just put it in here, and it will tell me what the other opposite thing is. And then I can start building a framework much more quickly than I could before. So I have it to where I put it in, it will give me the other term. I'll give it the yin, it will give me yang, right? Then it'll put, like, the, relationship honeycomb versus ground glass opacities. But then under that, it'll put those two sub bullet points where one is for the yin, one is for the yang. And And I really like that because it looks like a lot of text, which I usually don't like it to give me long responses. But the things that I don't actually have to like read all of it, I'll just look at like the, subheadings. Oh, restores, okay, rhythm control versus rate control drugs, right, for antiarrhythmia. Restores normal rhythm versus controls heart rate. So it's rhythm versus rate. Used for patients with symptomatic AFib versus persistent AFib. So it's symptomatic versus persistent. Examples, flecainide, amiodarone versus beta blockers and calcium channel blockers. Acute and long-term management versus just long-term management. And then if I want more clarification, then I can look at those sub-bullet points underneath. So I really, really like this one. It's a very big help. So as you can see all those examples and things. Like, see, this is one where it didn't give me what I wanted. I said response to bronchodilators, and it contrasted that to a response to corticosteroids, which is a valid relationship, but what I was looking for was, like, when the patient responds versus if they don't respond to a bronchodilator, what does that tell you? So I just put that in, and then he gave it to me. If they respond, you probably got a reversible obstruction, something that, giving the bronchodilators was able to reverse it. Versus if there's no response, that means it's a permanent structural problem, like a vocal cord paralysis. So that was the verses. Those are like really, really important. These are my 3 foundational techniques too that I put as the basis of everything else I do. Hyphen, equals, and verses. Because the etymology chat is basically the hyphen technique. So those 3 at the top are the most important, you could say. This am I correct one I really love as well. Nicknames, I barely use that. It's not really the best thing ever, but I kind of like it sometimes. I'll show it after. USMLE, you answer all my questions for the purposes of mastering USMLE Step. So with ChatGPT, you sometimes have to kind of like give it its role and everything. If you want to ask it a question, it will give you better, more accurate, or like information that's more honed to what you want based on the role you give it. So basically with USMLE, there's no like specific use for it like these other chats. I just use it to ask like questions in general. But I put that initial instruction of you are in the role of USMLE Step or whatever because I want it to answer from that perspective. Not just answering whatever random things from the internet. So it's mostly good. It's just faster than Googling things a lot of the time. And then if it makes a mistake or it's wrong or whatever, the thing is, when I'm learning things, I'm always like, combining it with the other things I learned. So if something doesn't make sense, then I will ask it and then it will correct itself. Or sometimes it corrects itself when it wasn't actually wrong. It really doesn't happen often, but that's the thing where it's like, it's just a quality over quantity thing. What I use it for is when I need speed, not for something that's super intricate and complicated and I'm not sure about the accuracy. If that was the case, then yes, I'll take the time to just look it up online or ask a professor. But for those simple things where it's like not complicated, but it's complicated to you because you don't know it yet, or you just need the information, that's what I use it for. So if it says something that doesn't make sense, I can tell because it will conflict with something else that I've learned. So I'll just like ask it, wait, what about this or whatever, or I'll look it up. So that's the USMLE one. Drug names. This one's actually like this one's like hit or miss. It's not like awesome like the other previous ones are like so helpful. It can be like really helpful, but it can also be like not. So basically I just told it, break down the drug name into its parts and explain basically what they mean. It's like an etymology chat, but specifically for pharmaceutical drugs, because what you'll find with the etymology chat is it doesn't actually work for drugs for whatever reason. Like if you try to like tell it a drug, it will say like some weird thing that's doesn't even make sense. Like let me do an example. I'll do an easy one, nifedipine that I mentioned before, because that dipine actually means something. It might actually get this one right, the etymology chat. No, it didn't get it right, see? Oh, well, okay, that's not that bad. It said pene, dihydropyridine. What's another one that has like a meaning to it? Ooh, minoxidil. So minoxidil is a vasodilator. So it's like it literally ends in dil, as in dilate. It ends in dial. But see, this thing doesn't even point it out. It says minnow, unknown, oxid, oxygen, ill, random nomenclature. So it's like very useless and unhelpful. But it's helpful for everything else, like Latin roots. It's because, drugs are not named based on Latin roots. They're named literally by random modern day people. It's like really weird. It's like random people that just like their job is to name drugs, and they're not even scientists or anything. So they just like come up with the names and everything. But I read a little thing about it online, but that's why the etymology chat doesn't do well. But with the drug names chat, because the instructions are specifically saying, okay, you're just focusing on drugs, it's more helpful. See, dill refers to its function as a vasodilator. So things like that for me are just a lifesaver in farm, because it's like, oh, that actually makes sense. So now I can actually remember it, and it just makes things a lot easier. So when it points something out that's good, like a good part of the name that you didn't notice, because that's one thing. There's a lot of things in these names that are like, it's telling you right there, but you don't notice it. That's very much true with actual terminology, like, anatomy, the jargon you have in anatomy and things like that. Pathology, that's like extremely true. Like all the names and the words and the names of diseases and things mean something. With farm, it's not always true. Like farm, a lot of times the name is just random and meaningless, which I don't like farm because it's more memorization because of that. But the ones that do have like meaningful things in them, it's really helpful like to have them pointed out. And it's like really it's painful when you don't have it pointed out and you're like, seriously, that would have been so helpful to know, because you like find out later. So that chat is for that, the drug names. And then the last one I haven't talked about is nicknames. Nicknames is almost like the connect equals chat. It's something I came up with before the connect equals chat. And yeah, it's basically this sort of thing. I barely use it, but it's like, okay, I put in TAM horsefly protein, kidney protector. That's true. The TAM horsefly protein basically like binds other like things that are in your tubule, in your, tubules in your kidney, and it like aggregates them together so they don't, cause problems or whatever. So I said, okay, peroxisome proliferated activator receptor alpha, lipid burner. That's actually exactly what I call it. So see, if I put it in again, it will give me like a different nickname. So I put the same thing again. It said fat metabolizer. This one, the lipid burner thing, I think is really cool because peroxisome, because of just like the ox and the idea of like oxygen and fire and everything. I always call it the burner because peroxisomes basically destroy things. And the PPAR thing is a antilipidemic drug, and it's specifically like the one that just burns fat. It just burns triglycerides. It doesn't stop absorption of fat and all this other stuff. It just directly burns the fat. So it was cool because the ChatGPT came up with the exact same nickname that I came up with. So it just shows that these nicknames are actually pretty good and intuitive that it comes up with. And it's just like a more casual, succinct, simple way of like summarizing what something is. So sometimes when the connect equals association is not simple enough for me, and I'm just like, okay, what is the point of this thing? Like, there's too much, you know what I'm saying? Like, I don't want all this extra blah, 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 blah. I just want to know, like, what's the actual main point of it? I'll put it into the nickname chat, and it's pretty nice. So sarcoid granuloma. That's accurate. That's what sarcoidosis is all about. It's granulomas. Yeah, CYP4 metabolizer, etc., etc. So that's that. Yeah, so that's it. So those are the chats I use for my studying. Yeah, so you just go to, like, you open a new chat. I'll show it on here actually. You click this button in the top right corner with the pencil symbol, or on the computer it might be in a different corner. But you click that. You just copy and paste the instructions, not the title, right? Not the word Eddie. I just put the instructions. And then those are the initial instructions. Here I didn't do it, but a lot of times I'll put like let's begin after I say something, because I want it to realize that those are initial instructions, not like I don't want it to start talking. I want it to just like take in those instructions and then start talking when I actually do something. So see, I'll put let's begin after it for a lot of them. And that's something that kind of like can sometimes make the instructions work better, like make it respond better. So after I do that, then I'll name it. I'll go here. I forgot to say what I was doing. I'll go to the name of the chat. It comes up with its own name, right? So rename, and then I put it something that's like short and all caps so that it stands out. So it's easy for me to quickly find that chat. And then you start doing it. So it's like some anatomy thing that they're doing right now. Glossopharyngeal nerve. Perfect. Glossopharyngeal comes from gloss equals tongue, pharynx equals your pharynx or your throat, and then obviously nerves are nerves. And it tells you that nerve, the word means sinew or tendon because they're like strings. Then it gives a purpose. Glossopharyngeal nerve gives sensory innervation to the throat and the back of the tongue, which is why it's named after the throat and the tongue. So trigeminal nerve has 3 parts. So yeah, I remember like back when I was taking anatomy, like every single term I was putting it in here, and it's really helpful. It makes it a lot easier to remember those terms when there's actual meaning to it. And then once you learn the word roots, I forgot to say this, once you learn those word roots, the same ones come up over and over and over and over, all throughout, you know, med school and medicine and everything, and it never stops. So it just like as you kind of learn the language of medicine and these different word roots, then it makes it so much easier as like new things come to piece together what they mean, and then you can predict, you can like know what words mean that you've never seen before. You can just know what they mean as soon as you see them because you know what the different parts that make the words up mean. So that's what they call learning the language of medicine, and that's kind of like something important that I guess you can do it like naturally or accidentally or whatever, but for me it was really helpful to do it on purpose by putting things into here and then just getting it told to me instead of having to like vaguely put it together over time. Pneumonitis, another example. Pneumo is lung, itis is inflammation. So inflammation of the lung, things like that. Yeah, actually I'm going to go to mine to see if there's like some more weird ones. Yeah, see, non-caseating granuloma. Caseous means cheese because it looks like cheese when it has all those holes in it and everything. Calcitriol. The calc is for calcium, of course, and then the triol, a molecule with 3 hydroxyl groups. Oh, so 3 OL, 3 like alcohol groups. Because those alcohol groups always end in OL. See, I didn't even know that. I didn't really read that one. Yeah, I use it for like gene names. It works for that. Even though it doesn't work for drugs, it works for gene names. So it'll tell me the whole name, bone morphogenetic protein receptor 2. Even for words that like I know what it means, like bronchiolitis is bronchial inflammation, but I want like, you know, more of a definition than that, I'll still put it in. Because it'll also tell why it's called that. So usual common interstitial between tissues, fibrosis is scarring in the interstitium. Oh yeah, myxoid, see, or a myxoma. Mix means mucus. That was really helpful to know. Then I was able to like put together those terms, myxoma, myxoid, and kind of come up with a way to remember it. Galactorrhea, rhea means flow. Just like diarrhea, that's like a poop flow. Rhinorrhea, that's a nose flow or a runny nose. Galactorrhea, milk flow. Abnormal flow of milk from the breast during breastfeeding. So that's how I learned like things like that from this. So yeah, those are the chats. Highly recommended.